Hey, hello everyone again and welcome. My name is Talia from the Massachusetts Health Connector, and I'm joined by my colleagues Nikki from the Health Connector and Jared from MassHealth, who will be presenting today's information. Together, we are here today to share information on renewing your MassHealth coverage or obtaining coverage through the Health Connector. We'd like to take a moment to thank our community partner organizations and elected officials across the state for their support in promoting this webinar, including our partners in the state legislature and congressional delegation. Before we get started, just some information about our presentation format. Everyone's audio has been muted and video has been turned off. Following the presentation portion, we will have time for a question and answer period. If you would like to ask a question at any time, please use the Q&A button at the bottom of your screen. We will be monitoring your questions throughout and we'll do our best to address them at the end of the session. When asking your questions, please do not share any personal information or private health information, as others on the call are able to see what you write. Lastly, we are recording today's webinar, so you'll receive an email with the presentation and the recording of today's presentation. So we will now get started, and I will pass it to Nikki to kick us off.
Thanks so much, Thalia, and thank you again, everyone, for joining us this evening. So I'm here with my colleague Jared from MassHealth, and we are planning to go over quite a bit of information. Really, the main focus of tonight's session is to talk about the MassHealth renewal process. And we're going to look at that and then also share information about how members can stay covered. So every year, MassHealth members need to renew their coverage so that they can receive the best benefit that they qualify for. So Jared's going to talk about what that means. He'll explain the renewal process and also share some just helpful information to you and to anyone who may be watching the video later. What happens as MassHealth goes through a renewal cycle is that some people might find out that they don't qualify for MassHealth anymore. So I will explain how someone can get coverage through the Health Connector and how some people may get help paying for that coverage with us. So I essentially covered this. My apologies, everyone. But we will explain what a MassHealth renewal is. We'll give you information about submitting a renewal, show you how to get help if you need it, tell you how to prepare for your next renewal, and then take you through the steps of how to get coverage through the state's Health Connector. Now, before we dive into the detail, we thought it might be helpful for all of you to get a better understanding of the relationship between MassHealth and the Health Connector. I think it's really important to note that we are separate organizations, separate agencies, but we have a very strong relationship. And in fact, we even share one application. So when a consumer applies, they don't need to know what they're applying for, but rather we just need to know that they're seeking coverage. So I'm going to hand it over to Jared to talk a bit about what MassHealth is overall, and then I will talk more about the Health Connector.
Awesome. Thank you, Nikki. Hi, everybody. Good evening. Thank you for joining us after typical business hours. It's nice to be able to present this information to you all. My name is Jared. I'm the Director of Special Projects and Operations for MassHealth. And on this slide, just some really basic information about what MassHealth is. So in short, MassHealth is Massachusetts state Medicaid and CHIP program. So we provide health benefits and help paying for those benefits to qualifying children, families, seniors, and people with disabilities who are living in Massachusetts. What you will notice on this slide is that MassHealth is a huge program. So we currently cover over 2 million people across the state. That equates to about 2 out of 3 people in low-income families, about a quarter of all residents across the Commonwealth, and about 42%, which is about 2 in 5 children of all incomes across the state. So the impact of MassHealth is obviously really significant. We provide a ton of coverage for folks. The nice thing about MassHealth is that we are health insurance, so we're covering health services comparable to commercial insurance. MassHealth is also special in that it covers certain services that are not typically covered by other insurers. A good example of that would be long-term services and supports, as well as some behavioral health services. So I know that Nikki's going to give you a little bit more information about the connector, just so folks understand the difference between MassHealth and the Health Connector. And then once Nikki is done with that piece, I will talk to you guys a little bit about the renewal process.
Great, thanks so much, Jared. So I just wanted to introduce the Health Connector to all of you in case you're not very familiar with who we are. So the Health Connector is the state's health insurance marketplace, and we're here to offer coverage to individuals and families, as well as small employers. Essentially, we're here to provide access to people who don't otherwise have access to coverage, either maybe through their own job or a spouse or partner's job. And a lot of people may find that they could qualify for help paying for some, or even some people may find that they qualify for a $0 monthly premium. Now, really important to note, specific to tonight's presentation, is that people transitioning from MassHealth or who don't get health insurance through their job, they may in fact qualify for coverage through us. Also, people can buy dental insurance through the state's Health Connector. And then we won't be covering this tonight, but it's good information to tuck in the back of your minds. When we are talking about coverage for small employers, we are able to offer small businesses with 50 or fewer employees access to a number of health insurance plans. So I kind of started this section off by explaining that MassHealth and Health Connector are separate organizations. However, we do share one application. And we hope that that is, beneficial for people in Massachusetts, families in Massachusetts. Because as I was saying before, there is only one application. Someone doesn't need to know exactly if they're applying for MassHealth coverage or Health Connector coverage, but rather they just provide the application with all of their information, and then the system will take all that information and determine the best benefit that someone can in fact qualify for. Now, the website for people to note is mahealthconnector.org. It's also important to note that the application is available in Spanish as well as Portuguese. And if anyone has previously applied for MassHealth coverage or Health Connector coverage, we really would encourage you to try to sign into your account rather than trying to create a new account. That will really just make things easier for you, simpler for you. And if you try to sign in and you can't, you're not able to remember your password, etc., there are certain online supports that can help you reset your password. But essentially, just want you to know that this is what the landing page looks like when you come to our website. And again, if you want to take a look at that, certainly this is what you would need to do. Now, I will pass it back over to Jared and let him talk to you about MassHealth renewals.
Thank you, Nikki. All right, so lots of fun information here about MassHealth renewals. So first question is, what is a MassHealth renewal? So in Massachusetts, we are the state's Medicaid program, which means that we have to follow state and federal rules. One of those rules is that we have to periodically check if members are still eligible for coverage. So in Massachusetts and across the country and other Medicaid programs, that process happens every year. So this is the annual process to check and see if people are still eligible for coverage. That is what we refer to as a renewal. You are going to notice across this presentation that in a number of different spots, we are reminding folks that the renewal process happens every year. I will explain a little bit more about why we're really emphasizing that here on the next slide. But as a MassHealth member, that's the important thing to remember, is that every year MassHealth has to check and see if you are still eligible. So when it is your turn to renew your coverage, there are two main things that MassHealth is going to try to do. So the first thing that we're going to attempt is we are going to see if we can renew your coverage automatically. If MassHealth can renew your coverage automatically, it means that you don't actually need to do anything, right? What we do on the MassHealth side is that we can check certain state and federal data sources. And if we're able to confirm certain information for folks, we might be able to just say, hey, we can confirm their information is correct, and we're able to just automatically renew that individual's coverage. If you are automatically renewed, you will get a letter in the mail from MassHealth in a white envelope that lets you know that your coverage has been automatically renewed. So that is for some people. It's not possible for everybody, right? So there's no guarantee that we'll be able to automatically renew coverage, but we will try to do so for everybody in your household. If your coverage cannot be renewed on an automatic basis, what we will do instead is we will send you a big blue envelope in the mail, and you will need to respond to that envelope to provide MassHealth with information so that we can confirm that you are still eligible for coverage. So why are we talking about renewals now? So first and foremost, we really want to make sure that members understand the process, right? Understanding how renewals work hopefully is going to result in people being eligible for the best benefit that they qualify for. And of course, that's the goal. The other piece is that we never want somebody to lose coverage simply because they failed to respond or didn't receive a renewal notice, right? So the reason that we're trying to get the word out is because we want members to be prepared. We want them to understand and get used to the annual process of renewing their coverage. And again, we never want to see somebody's coverage lapse just because they didn't get back to us, even if they would otherwise be eligible. The third bullet, which I think gets to some of the reason why we keep saying, hey, renewals are an annual process. It happens every year. It's because during the COVID-19 public health emergency, there were some special rules in place that were temporary, where we had paused our renewal process, right? So for certain members, especially people who are new to MassHealth as of like early 2020, they're not used to the renewal process, right? So again, this is why from our standpoint with MassHealth, we're trying to message to folks that the renewal process happens every single year, and we're trying to make sure that folks understand what the process is. So here is the blue envelope. We gave you a nice big picture of it. So if you are required to complete a renewal, right? So if it's your turn to renew coverage, we try to automatically renew, but for whatever reason, we can't automatically do it, you will get a blue envelope in the mail. As a MassHealth member, you have to remember, if you get the blue envelope, you have to respond to it. If you don't respond to the blue envelope, it is possible that you lose your coverage. We don't want that. We don't want people finding out that they lost coverage because they go to the pharmacy and are trying to pick up medication and they find out, hey, my MassHealth coverage is no longer active, right? That's really what we're trying to prevent. So if you see a blue envelope in the mail, make sure you open it and make sure you follow the instructions. When you open that blue envelope, what you're going to see is you're going to get information about what you're supposed to do. So you get some instructions. You're going to get the actual paperwork itself, so the renewal paperwork that you need to fill out. And it's also going to give you a due date. Typically, members will have 45 days to complete your renewal paperwork. So what we do is we put your due date out a little while to account for the amount of time that it takes that envelope to reach you in the mail. But typically what we'll provide is we'll give 45 days for folks to respond, okay? One important note is that when we send out a renewal, it happens at the household level. So these notices, like the blue envelopes, are sent to the head of household. And you'll see on the presentation, there's a little footnote where we define a household according to folks' annual tax filing relationships. And the household is the head of household, who is person one on the application, their spouse if they have one, and any dependents such as folks, children and other individuals who you'd claim on your taxes. So what happens after you send your renewal paperwork to MassHealth? And I will get to this a little later in the presentation. There's actually a few different ways that you can send it. You don't actually have to just physically mail it. There's some online options too. So after you complete your renewal paperwork, of course, you have to send it back to MassHealth by the deadline. Once you do that, the best recommendation that I can give to folks is make sure you keep checking your mail, okay? If you get letters from MassHealth or the Commonwealth of Massachusetts, please open them right away. Don't let them sit. What happens sometimes is somebody will fill out their renewal. They get their blue envelope, they fill out the information, they send it back to us. If MassHealth is having trouble validating some information, or if we need extra information from you. So for instance, we say, hey, we weren't able to verify your income data. We need to see, copies of some of your pay stubs or something, right? We will send what's called a request for information, and it is exactly what it sounds like, right? We are just asking for additional information. A few things to keep in mind. If we send you that request for information, it is going to be in a white envelope, right? Seems a little bit silly to say out loud, but I'm going to say it anyway. Even though your renewal notice comes in a blue envelope, if we're asking for more info, that's going to come in a white envelope. So please make sure you keep checking your mail. If we ask you for more information, you're going to get extra time to respond. So we typically give 90 days for folks to respond to that request for information. Okay, so it should be plenty of time for you to collect your information and send it back to us. If you get a request for information, but you don't respond to it, you could lose your coverage. And again, we don't want that to happen just because somebody failed to get back to us, right? So when we're done processing your renewal, right? So you sent your paperwork to us, we took a look at it, we made an eligibility determination, right? You're going to get a letter that's going to tell you what level of coverage you are eligible for. And of course, we will always give you the best benefit that you qualify for. If it turns out that you are not eligible for coverage, we will give you at least 14 days notice before the end of your coverage. Again, really important that you read that mail. For example, when we send, if we say, hey, you're over the income limit, you don't qualify for MassHealth anymore, there's going to be paperwork in that notice that tells you important stuff like how to file an appeal, for instance, if you don't agree with the decision that MassHealth made, right? And again, we just want to make sure that everybody has this information. And if you disagree, you have due process rights where you can submit an appeal to MassHealth, and that will include some instructions. Okay, so as I mentioned before, there's a few different ways that you can submit your renewal. So if you get that blue envelope in the mail, what we recommend, the easiest way for the majority of folks is that you can go online. There is a difference for folks who are under 65 versus those who are 65 or older who are living in the community, as well as certain folks who have disabilities and are receiving nursing facility care or home and community-based waiver services, okay? So depending on which group you fall into, there are two different websites that you can go to, and this slide has instructions. I don't know if we mentioned this at the beginning of the presentation, but I will assure you, if you've registered for this webinar, we will send you a copy of the slides. You don't have to like take down all of these web addresses because I know we're giving you all a lot of links and information. So anyway, there's two sites that you can go to depending on which group you fit into. If you are not comfortable going online or you don't have internet access or whatever the case is, you can also submit your renewal back to us by mail, and we give you information on the screen about how to do that. You can do a telephone application in a lot of cases, right? And you just call our main customer service number at MassHealth, and you'll speak to a representative. They can talk to you about how to do it. And you could also schedule an appointment with a MassHealth representative, and we have a link for how you can schedule those appointments as well, okay? Again, 45 days, okay? So 45 calendar days is the amount of time that folks typically have to complete the renewal and send it back to MassHealth. There is just one note, if folks are under 65, if you there are certain groups of folks who have their eligibility for MassHealth through a different program. So for instance, if you get Social Security, it's possible that you automatically get MassHealth because you're eligible for like SSI, right? Some of those folks are not going to be able to create a Mass login account. But if you are in that situation, you probably would not have received a blue envelope in the first place. If you have a question or if you have a concern, call us, right? Don't leave anything to doubt. There's a lot of ways that you can get help. Just give us a call if you have questions. All right, so that is a good transition to if you are a member and you are feeling stuck, right? You have questions, you don't know how to move forward, the application is really confusing and you're not sure what to put. There's a lot of different ways that folks can get help, okay? So the first resource that we list on the screen is MassHealth has 7 enrollment centers, and we call those MECs, which stands for MassHealth Enrollment Center. We have 7 of those MECs that are located across the state. You will see there is a website that we provide if you want to look up a MEC. The nice thing is that we have a new tool for scheduling appointments with somebody at a MEC. We offer a few different options for doing those. They can be via phone. You could do a virtual appointment, or if you are in the Springfield area, we can do in-person scheduling in advance. That's going to be rolled out to other sites as well, probably in the future. But for right now, we can only do that in Springfield. But you can also walk in if you need, right? So we have those MassHealth enrollment centers where you can speak directly to a MassHealth representative. The second group is that we have certain folks who are what we call assisters or certified application counselors, which has a fun acronym of CAC. So if you hear somebody talking about a CAC, they are talking about a certified application counselor. And we also have navigators, right? And the important thing to remember about that, it's a lot of different terms, is that these are folks, they don't work for MassHealth, but we do provide them with training so that they can help members apply and renew their MassHealth insurance, right? So there is a link on here if you are looking for some help. Strongly recommend you can click on that link. We have all sorts of assisters located throughout the Commonwealth. Typically, you can find one pretty close to you. You might have to get an appointment, but again, if you go to the website, you'll get lots of contact information. And then the third resource that we list, which is always available to folks during business hours, is the MassHealth Customer Service Center. And we are listing on here our 1-800 number. Just saying you don't have to speak English to speak to a MassHealth representative. We have assistance in a wide range of languages. If somebody is calling and they speak a less common language, we can still get an interpreter on the phone. But again, you can always just give us a call. And I would suggest when in doubt, if you have questions or you're concerned or you're worried your coverage is going to lapse, give us a call and a representative can look up your case and give you some information. So if you have done your renewal, it's typically going to be every year, right? So let's say last year you did your renewal around April. You could expect you should be getting your blue envelope sometime around April of this year. But let's say it's been a little bit of time, or maybe you just completed your renewal and you want to know, hey, what can I do to prepare, right? So the 2 big things that we would suggest, and the first one, again, I will stress this because it's super important. Please make sure that MassHealth has your contact information. We make sure we have your email address, your phone number, your mailing address, all of that stuff, right? Because what's going to happen is if you moved, if you changed phone numbers, if you got a new email address, we're going to be trying to reach out to you to let you know that your coverage needs to be renewed. It's not going to work if we can't actually reach you, right? I know that when people move and they have things going on in their lives, like the first thing in your mind is not like, let me call MassHealth and give them the update, but take this as a reminder, right? That if your contact information changes, please make sure you update it with us. Or if you're not sure what contact information we have on file, update it anyway, okay? You can give us a call to update the contact info. There's also a couple different online options that you can pursue. And again, we will email this deck out to everybody, so you can just click directly on those links. The second thing, and I've said this like 50 times already, please just read all of the mail that could be from MassHealth. right? When we have questions, when we need information, when we need to reach out to you, we are always going to send you a letter in the mail, right? You have to make sure that you're opening those pieces of mail. And it's not just the blue envelope. The blue envelope is obviously very important, but we send other letters in white envelopes too. So you should be on the lookout for the blue envelope, but truthfully, any mail that could be coming from MassHealth, make sure you open it. All right. So this is the wrap up, and then I'm going to give you a little bit of transition information to give it back to Nikki. So again, recognizing that we've gave people a lot of information, right? I'm going to give you 5 things to keep in mind that I think are the main 5 things that you should be thinking about as a member when you talk about keeping your coverage. Okay. The first one, which we said a bunch of times, if you are a MassHealth member, you have to renew your coverage every year. Okay. The second point is that if it's your time to complete a renewal, you're going to get a blue envelope in the mail, right? Like I said before, we will always try to automatically renew your coverage. If we can't do that, we will send you a blue envelope. I will also note too, if you got a blue envelope last time, it's possible you could get automatically renewed or vice versa. Just because you were automatically renewed one year does not guarantee that it happens the next year. So always make sure to be on the lookout for that blue envelope. Okay. Number 3, which you're probably tired of hearing me say, is check your mail regularly. Open all of the mail from MassHealth, including things that come in a blue or white envelope. The fourth, which we just talked about, is to make sure that we have your updated contact information. You can always give us a call to update your contact info, or again, there's a couple links on the slide. And then the fifth, which I think is arguably the most important, give us a call, right? We're here to help. We don't want to see people lose coverage. We are absolutely committed to making sure that folks have the best coverage that they qualify for. So if you need a hand, if you're confused or overwhelmed with the information that we're providing, just call us, okay? And you can speak to a representative. So this is the lovely transition back to the connectors presentation, and Nikki's going to give you a bunch of information in just a moment about that. So it is possible that as you go through the renewal process, you may no longer qualify for MassHealth, right? And depending on the type of member you are, particularly under 65 versus over 65, right? There's certain criteria that you have to meet in terms of your income or your assets. So if you go through the process and you lose your MassHealth coverage, there are other affordable options. So for folks who are under 65, there are plan options that are available through the Health Connector, and we're giving you some information here with the website, also some information about the loss of MassHealth coverage being a qualifying life event. Again, Nikki's going to give you a lot more information here in just a moment. If you are over 65, again, there are other affordable options. If you do not qualify for Medicare, you might be eligible for coverage through the Health Connector. If you are eligible for Medicare, the loss of your MassHealth coverage, again, it's a special enrollment period. So you can enroll outside of the standard open enrollment periods. If you're not eligible for MassHealth, you may still qualify for what we call MSP, which stands for the Medicare Savings Program, which is a federal program that can help pay for Medicare recipients' premiums, deductibles, co-pays, co-insurance, things like that. Also, there are some special categories of programs. So for instance, the Frail Elder Waiver, PACE program, which is the program for all-inclusive care for the elderly, but typically people just call it PACE, or Prescription Advantage. Some of those programs run through your local aging service access points. So there are, we call those ASAPs. There are ASAPs across the Commonwealth. And those, if you think you might qualify for one of these programs, or if you have questions, if you've lost your MassHealth coverage, you can definitely call your local ASAP and they should be able to give you some more information. So with that, I'm going to pass it back to Nikki, who's going to give you some more information about the connector.
Thanks so much, Jared. And folks, thank you for sticking with us. So as Jared mentioned, there could be options if someone is going through their renewal process and they find that they are no longer eligible for MassHealth. There could be options through the Health Connector, or you may be someone who found yourself at this webinar because you've never applied for coverage before. So I will try to talk about our programs from both perspectives, just in case anyone has made their way here for that reason. So I guess the first thing I'd like to acknowledge is that, as Jared had explained, there were special rules put in place because of the COVID-19 public health emergency. So some MassHealth members may have gotten a new position or acquired a new job. So it may be that you are no longer eligible for MassHealth, but you may be eligible for health insurance coverage through your job. So it's something that if you are working for a new employer, or you've been with this employer for a couple of years, you may want to check with them first. Reach out to the Human Resources Department, the Benefits Department, to find out if you could be eligible for benefits for yourself or your family. And then, of course, you want to get the details of those plans. So what is the cost? How much is the employer going to contribute? What would you have to contribute out of your weekly or biweekly paycheck? And then what are their deadlines? When do you need to make a final decision to enroll in an employer-sponsored health insurance coverage plan? Now, what's really important for people to know is that there is a rule with the Health Connector, and if someone has access to affordable coverage through an employer, then somebody would not be eligible for financial help through the Health Connector. But there may be circumstances when someone is offered coverage by the employer, but it doesn't seem affordable based on your position, based on your salary, maybe based on the number of people in your household. So we want to acknowledge that Health Connector plans and the savings associated with them could be available to you if you don't have access to health insurance that is considered affordable, as is outlined by the state's affordability standards. So you can, in fact, complete an online application or paper application or an application with assistance from a community partner. But you will need to provide detailed information about the employer's plan offerings so that you can incorporate that information into your application. So when you do get these slides, you can click on this link. There is a worksheet that you can give to your employer so that they can help you with the responses needed for the application, so that we can determine whether or not you and your family could be eligible for savings through the Health Connector rather than going with your employer-sponsored plan. Now, what about qualifying to enroll into coverage? So very specifically for tonight's presentation, we are thinking about people who might have lost access to MassHealth coverage. Because that may have happened to you, it is considered a qualifying life event. So you want to just know that that means you have a special enrollment period. You can, when that happens, or if that happened, you can either enroll in or you can change your health insurance plan, and you don't have to stay in the annual open enrollment period. So you can do that outside of our typical enrollment period. So in addition to losing access to MassHealth coverage, there are other life events that could let somebody qualify to get this special enrollment period. So let's just say there's been a change in your household size. There has been, your household size has increased or decreased. Your income has gone up or down, or you've experienced other life changes, like you've recently gotten married or have a baby, or you may have lost a job-based health insurance. So these are all different reasons. But if you have any of those reasons, you really want to report any qualifying event as soon as possible. Because there are in fact rules around when somebody can report that. But again, if you lose access to MassHealth coverage, know that you're going to automatically get a special enrollment period. Now, during that special enrollment period, if you owe a payment or you need to choose your plan, both payment and enrollment deadlines still apply. during that special enrollment period. So please, as Jared was saying, review your mail that you receive, check the dates on the items that you're getting, because we do want to get you into coverage and keep you into coverage. Now, let's talk a little bit about Health Connector plans. So I think it's important for anyone who's interested in getting coverage to us to understand that all of the plans sold through the Health Connector meet state and federal coverage standards. So what does that mean? It means you never have to worry about whether or not the plan that you're getting for the Health Connector is comprehensive or not. You also, in Massachusetts, there is a requirement for most adults to have health insurance. Now, you wouldn't, have health insurance or face a tax penalty. If you get coverage through the Health Connector, you never have to worry that our plans don't qualify. So our plans are qualified health and dental plans. Depending on where you live in Massachusetts, you can choose from a variety of plans from leading insurance companies. Through the state's Health Connector, there are different ways to save money. So people can qualify for advanced premium tax credits. And basically the way that works is those tax credits reduce the cost of monthly premiums. Now, what's unique to Massachusetts is we have a program called Connector Care. So for people in lower income ranges who meet other eligibility requirements, you might qualify for low or no cost health insurance coverage. So really important to think of those as advantages right now. And on this slide here, I want to talk to you about what's new at the Health Connector for this plan year, and actually for 2025 as well. So the Health Connector has a pilot program that has expanded eligibility for the Connector Care program, which is really giving people subsidized premiums, low copays, no deductibles. So if you are a new Connector Care member, these are going to be pretty, this is pretty exciting. This is something that I think people really do appreciate, because these are comprehensive plans. Now, in terms of the plan choices, any health insurance company that participates in the Health Connector, anyone who's on the marketplace actually is offering plans in Connector Care starting this year. So all of these changes took effect on January 1. But basically what that means is, well, before there were just a subset of the carriers who participated in Connector Care. Now they all participate. Now let's take a look at the income limits that I had talked about. For an individual, the income limit for one person for Connector Care has been increased to $72,900 for coverage year 2024. And if you are a family of four, the change of income limit has gone up to $150,000 for 2024. So that has been, if you look at what it was previously, there has been a significant increase for both individuals and families, so that more people can now qualify. So you might be wondering, okay, that seems great, but how do I know for myself? Like, do I have to complete a full application to find out if I could qualify for the Health Connector? And can I qualify for any savings? Can I qualify for tax credits? Do I qualify for Connector Care? We have Get an Estimate tool, which lets you see what could be available to you and what you may pay. So if you go to the Health Connector's website at mahealthconnector.org, in the upper left-hand corner, you'll see a link to get an estimate. Also, of course, when you get these slides, you can click directly on these links. Now, once you see an estimate of the plans that could be available to you, you might be wondering, okay, this is great. Let's see, I found this plan that seems fairly affordable to me. are the doctors, are the hospitals that I want going to be covered in this plan? So we have a plan comparison tool. In fact, you can also compare medication too. So you can find out by using this tool, and again, you can get to this from our website, or you can also get to this tool when you're in your application. It's called something slightly different, but it really is the same tool, whether you're looking at plan comparison or plan finder. You can just see hospitals, health centers, certain providers, specialists. You can just check to see if they're going to be affiliated with that new plan that you're interested in. Okay, so what should you know about applying? So this is really helpful. I had mentioned earlier that MassHealth and the Health Connector are different organizations. We have different programs available to Massachusetts residents. However, we do share that one common application at mahealthconnector.org. Also, I mentioned before, we have a Spanish website, and when we send out the follow-up link, we will certainly share the link to the Portuguese version of our application as well. You can, if you don't have access to the internet, you don't feel comfortable completing an online application, you can also complete an application over the phone through Health Connector customer service. Or when Jared earlier was talking about certified assisters, so navigators and certified application counselors, we have a number, like more than 1,000 in Massachusetts, of individuals who have been trained and certified by MassHealth and the Health Connector, and they can help you. Remember, you only have to complete one application to find out if you qualify for coverage through either the Health Connector or MassHealth, and you're going to get letters from both the Health Connector and MassHealth that tell you your next steps. So as Jared said, please, please keep your mail, open your mail. If you're having a hard time understanding what the letter says, you can also contact one of these community organizations, make an appointment, say, I just need some support on, what next steps I need to take, and they can certainly assist you. So let me provide you with some additional information about free enrollment assistance, free support. So Jared shared some contact information for MassHealth customer service. The Health Connector also has a customer service number. It's 877-MA-ENROLL or 877-623-6765. We also have a TTY number. When you go onto our website, you can click to see the hours of operation. Typically during open enrollment, we have some weekend hours, and usually we're open from 8 a.m. to 6 p.m. But also you might be able to get some support at a local event. So I encourage people to look on our webpage for upcoming events, and you can check and see if we're going to be in a location near you. I want to repeat information about our community partners. Jared and I are talking about the same people. These are people who are trained and certified. They speak many languages, and really they can help somebody from application through enrollment, even if they have questions later about their health insurance plan. Really, these are great resources in your community. And a lot of times we hear that once somebody establishes a relationship with a certified assister, they maintain that relationship. They may go see them once a year and just make sure everything is, in ship shape. And it's easy to find, folks. You can click on Get Free Help near you. And this is, again, you will get these slides, but you can also, if you call either one of our customer service centers and tell them that you want to see someone close to you, you'd like to see them in person, etc., they can also help you find a certified assister. So I have a couple of key Health Connector takeaways before I go back to Jared and Thalia, and we take questions from everyone. First, I just want to remind anybody, if you have lost access to MassHealth coverage and you still need health insurance, dental insurance, you can enroll through the Health Connector. You're going to have what's known as a special enrollment period because losing MassHealth is considered a qualifying life event. Remember, MassHealth and the Health Connector are different organizations, but the Health Connector is here to offer coverage for individuals, families, and small employers. Now, if somebody qualifies for a Health Connector plan, qualifies for a Health Connector plan, there are a couple of steps that you're going to need to take. First, you need to apply. Once you do apply and find out what you are eligible for, you're going to need to make a plan selection, enroll in that coverage, and if a payment is due, you're going to need to make your first premium payment by the 23rd of the month before coverage can start. So what does that really mean? If you are on tonight's webinar and you need coverage that begins on May 1st, means you need to complete an application, choose your plan, and pay by April 23rd for that coverage to start. Now, remember, you can apply for coverage online, over the phone, or with the help of a local assister. And you can get support with this process in its entirety, all for free. So really, truly just want to encourage anybody to call, call as soon as you can, probably not this evening, but call tomorrow if you want to make an appointment for help. And you can certainly, get connected to free support. So with that, Jared and Thalia, I think we are ready to come back. And I peeked a little bit earlier at some of the questions. It might be worth just noting, Thalia, before I hand it over to you, that we will we'll be looking at all the questions. We may try to synthesize the question a little bit so that we're answering it a little more generally to provide more information to all participants. So I will trust both you and Jared first to tell me where you'd like to go. Thank you.
I also do want to mention that I have been answering some questions on the back end and providing some links for people who have questions about the Connector Care program and any assister information. The links are in there as well. So if anyone has questions about that. I did see this question come up. Is there any different webinars for folks looking to sign up for MassHealth for the first time?
So, Celia, that's a good question. And I also want to address a similar question that I saw in the chat. There were a few people who were asking about like eligibility criteria for MassHealth, or like somebody had a question about like somebody who recently immigrated to the US or recently came to Massachusetts, like how do they apply? The thing that I would say to folks, and I know that this is not going to be like the most comforting answer. So eligibility criteria for MassHealth can be pretty complicated because it very much depends on the individual person, right? So as like an example, right? So there's like income requirements, for instance, for people to qualify. So if you make too much money, you're not going to be eligible for MassHealth, but it depends on if like you could have a household where there are children, for instance, who are eligible for MassHealth, but the parents make too much money and so the parents don't qualify, right? So on the MassHealth side, it is individual, it's an individual determination of whether or not somebody is eligible for Medicaid. And the rules, again, it can be really complicated because it depends in some cases on age. It can depend on disability status. It can depend on whether somebody qualifies for like a certain kind of waiver service, right? So just saying like the criteria is a little bit complicated. What I would recommend for folks though is both Nikki and I talked about all of these wonderful assisters who are located throughout the community who can give you some one-on-one information about qualifying for eligibility. I would really recommend that you use those links that are in the presentation and get in touch with somebody close to you so that you can have a conversation. Similarly, if you have a question, you can also call MassHealth customer service and you can have a conversation with one of our representatives, but it's not it's not like a one size fits all answer. So Talia, I recognize that I didn't totally answer the question you asked, which was also, is there a webinar for people who are like just looking to apply for MassHealth? Unfortunately, I'm not aware of any that are being done through MassHealth right now. But again, you should look at those links and try to find an assister, one of those like certified application counselors or navigators, right? I would click on that link and try to talk to somebody, and they can give you some individual information, which hopefully is going to be helpful for folks.
Okay, and we also had questions about COBRA, basically COBRA versus MassHealth, and if people have COBRA, will they still be eligible for a plan with the Health Connector?
Sure. So I'm happy to talk a little bit about COBRA and the Health Connector. So I think it's important to acknowledge that if someone has lost access to employer-sponsored insurance, depending on what happens with that company, a person could be eligible for COBRA benefits, which basically means that they can continue on in the health insurance plan that was offered by the company, but typically the company stops contributing money. So you, as the former employee, basically would be paying the full bill of that monthly insurance, which could be, quite expensive for you individually. So before someone enrolls into COBRA, we really encourage them to come to the state's Health Connector or MassHealth, complete that one application, and see if you qualify for either MassHealth or the Health Connector. I think it's worth just noting for people that MassHealth and the Health Connector, we look at income slightly differently. For the state's Health Connector, we look at what someone's income looks like for the entire year. So right now we're in April. If you had worked the first few months of this year, and then now, mid-April, let's say, you're like, okay, I'm no longer employed. We take that income that you've made already into consideration, and we ask you to estimate what your income is going to be for the entire year. So because of that, I can't say, oh, somebody would definitely be eligible for MassHealth. And as Jared was saying, there are a lot of individual circumstances that would help or it would not allow someone, could or could not allow someone to be eligible for MassHealth or the Health Connector. But the good news is you only have to complete one application. So I'm hoping that answered. That was probably a very long way to answer the question, Thalia, but I'm hoping it helped. And Jared, I don't know if there's anything you'd want to add to that.
Nick, I think you covered it. Thanks. Talia, do you mind if I just answer? There was one question that came up that I thought would be just like a good one to answer. So somebody said that they had a friend who's receiving Social Security benefits who did receive a blue envelope, and they were asking how to address it. It's a really good question. Anybody who gets a blue envelope needs to respond to it, right? So I out of an abundance of caution, right? I don't know exactly what happened in that person's case, but if you get the blue envelope, you have to reply back. They can certainly call customer service. And if they have questions or they're concerned about why they received the blue envelope, they can give us a call and try to talk to somebody. But if you get that blue envelope in the mail, you definitely do have to respond. And if you don't respond, it's possible that you could lose your MassHealth coverage. We, of course, don't want that to happen to anybody. So really good question, right? Like if you're like, hey, why did I get the blue envelope? Like still plan to do it. You can always give us a call if you have questions or concerns. But again, we would always advise somebody to fill that information out.
Okay, we also had a question asking if the Health Connector options are equivalent to private health insurance and if they can apply at any time or if they are not in a renewal period.
Okay. So I think the easiest way to explain Health Connector plans is that they're qualified health plans, meaning they meet state and federal coverage standards. They are commercial health insurance plans. You could buy the same exact plans directly from the health insurance carrier. However, all the plans that are sold on the marketplace, the state's website, you can just rest assured that they meet all state and federal requirements. Dalia, I forgot the second part of your question. My apologies. Go ahead.
The person was just asking if they would still be able to apply even if they are not in an open enrollment period.
Gotcha. Thank you so much. Okay. So in terms of applying for Health Connector coverage, you should apply. If you need health insurance coverage, I think the simple answer is just apply. You may meet a qualifying life event. Sometimes people don't know that they meet a qualifying life event, but I think it's just worth applying. If you do meet that event, and you have any certain life change that will open a special enrollment period, you'll be able to get into coverage.
Can I just add one piece to that? Nobody asked this question, but it seems like a good opportunity to say, MassHealth does not operate the same way. Medicaid programs don't have, like in Massachusetts, our Medicaid program doesn't have like an open enrollment period. So for the connector, like Nikki said, there's certain ways to do it. There's certain circumstances in which you can apply outside of the open enrollment period. For MassHealth, you can apply at any time, right? So for the MassHealth piece, if you're looking to apply for coverage, you should just give us a call and submit an application as soon as you want to do so. You don't have to wait for a certain period of time.
I'm glad you brought that up, Jared, because sometimes people will say, I'm not even sure what I'm looking for, what I could qualify for. And it's just, we just please encourage, if you need some help with health coverage, just apply and we can, there are folks who can help get you over the finish line.
Okay, I'm also seeing a couple questions about how to report income on your application for individuals versus household income, and also if it's like your gross income, how you should be reporting.
Jared, do you want me to start? And then if there is anything you want to add to it?
Sure. Yeah.
So essentially, I think I mentioned that the Health Connector looks, when we're making an assessment, we look at your tax filing household, but we look at the income for the entire year. When you are going, and MassHealth looks at this slightly differently. So when you're completing your application, you're going to be asked about any income that you're receiving on a regular basis. You're going to be asked whether it is monthly income, weekly, bi-weekly, etc. And then we need to know about the income source. We use what's known as modified adjusted gross income. So I think all you really need to know about that is that the system does all that calculating for you. You just have to answer the questions as they're asked. So Jared, I want to pass it over to you. I hope I didn't oversimplify that.
No, I think that that's accurate. I mean, again, the application process for MassHealth can be a little bit complicated in terms of what the requirements are. I think that what I would prefer to say in this case is that if you have questions about what to list, give us a call at MassHealth or speak to one of those assisters, right, who can give you a little bit more guidance, because it is a little bit tricky, and I'm not an eligibility expert myself, and I would hate to give somebody the wrong information. But again, we have folks throughout the community, and we have trained representatives on our customer service line who can answer those kinds of questions.
All right, and I think we have time for one more question. There's still questions on the connector care. Does connector care, it's asking why connector care does not cover dental, or if it does. And also, is it an extension of MassHealth? So more questions on connector care.
Sure. So really briefly, connector care is not an extension of MassHealth. Rather, it is a specific program offered through the Health Connector. The connector care plans, typically, I'm just thinking about, we do not have dental rolled into connector care plans. I believe when you initially get determined eligible, I think you may have a limited health safety net dental benefit. I'm not 100% certain, but I will find out and we can maybe provide a little bit of that information. But if you wanted to buy a dental plan through the Health Connector, you absolutely can. I'm not sure, Thalia, is there anything else with that? Or Jared, is there anything you'd want to add? I don't know about MassHealth and dental. I don't know if that is something that automatically comes with MassHealth coverage.
I'm not sure. And again, I'm like very conservative in answering this stuff because I don't want to give people the wrong information. I also want to say too, so I know that we're a minute over and we have to wrap. We're still getting some amount of questions, and some of the questions that I'm seeing in the chat are like very specific, or are, you know, like I'm seeing like a few people repeating the question about like what are the income limits, for instance, for MassHealth. And again, the answer is that it's complicated, right? Like there is no one answer for that question. It depends on a lot of different factors. Would really recommend, again, contact customer service, find a local assister who is close to you who can help answer the questions. Somebody asked if they can do a walk-in for the CACs. I think it depends on the organization and how they're structured, but I would just give them a call, right? Like there's a listing on the link that we're going to provide in this presentation. I would find somebody near you and I would give them a call and they can give you the information, because you know, it's hard to give really detailed info in a setting like this. But if you have questions specific to your situation or people you know, that's where those assisters are going to be really helpful, because they can actually sit down with you one-on-one to answer some of the stuff that we're not going to be able to answer in the presentation today.
Yeah, and Jared, I think one thing too that you just reminded me of that I think could be very helpful for everyone, and we'll give you the link to this. There is a member booklet that comes with the application. And when you look through that, you can see all of the different programs, all of the different offerings from the Health Connector in MassHealth. So if somebody has something in mind, they can see some of the nuances that, you know, we're talking about. So they can find some of that information. But you're right, it is very nuanced. So we can certainly provide that link as well when we do the follow-up email. So I think I don't want to cut either Talia or Jared off, but what I do want to say is that we will be sending anyone who registered for this webinar, we will be sending them this PowerPoint presentation. We'll also be sending a link to the YouTube video of this presentation. In the follow-up email, there are going to be a set of links to more information about things that we've talked about, and direct links to find a local assister. So either a local certified application counselor or a local navigator. So with that, I'd love to hand it back to Jared, and if you want to give any closing remarks.
I don't want to keep anybody longer. Just want to say thank you, everybody, for attending. Really appreciate the questions. And again, encourage you to reach out if you have questions. You can contact a local assister, give us a call at customer service. And again, I hope everybody has a great night. Thanks for taking time out of your schedule to listen to us today.
Thanks so much, everyone.